Have you ever felt confused about COVID-19 vaccines? You are not alone. The science moves fast, the names changes, and even the guideline on how to get the vaccine changes every couple of months. And sometimes the details feel overwhelming. Today, we are going to take the official package insert of the COVID-19 vaccine that was just updated in August of 2025 by the FDA, and I will help translate it into plain English so that you can feel safe, informed, and confident about your health choices related to the vaccine. Hi friends and rheumatoid arthritis warriors, I am Dr. Subedi, also known as the Rheum Doc, and the co-founder of Empower Arthritis here in Cary, North Carolina. I am a board-certified rheumatologist and I have spent over a decade caring for patients with autoimmune diseases including rheumatoid arthritis. And these are the people who are often at the highest risk of having severe COVID infection. Today, we will go through the official package insert review on COVID-19 vaccine, in particular the Pfizer vaccine. Now, the first question that comes up is, who is this vaccine for? The FDA has recommended this vaccine for people age 65 and plus, and for ages 5 to 64 with at least one underlying condition that increase your risk of having severe COVID-19 infection. Now, let me make it a little more easier to understand so that everybody is on the same page. So the vaccine is recommended for people 65 plus and anybody from 5 to 64 with at least one medical condition. And you might be wondering, what are those medical conditions? These medical conditions could include diabetes, heart disease, lung problem, and autoimmune conditions such as rheumatoid arthritis. So many of you who are watching this video may have these conditions like rheumatoid arthritis or lupus. These are the people who truly benefit from the vaccine. In my clinic, I have seen many patients with rheumatoid arthritis and lupus worry about whether vaccines are safe for them or not. This document shows us that this vaccine is safe and effective to prevent future risk of severe COVID infection. Hence, to summarize, the question of who is this vaccine for? Anybody above the age of 65 and anybody from the age 5 to 64 with any other medical conditions are eligible and will benefit from the vaccine. Now, the next question everybody will have is, how is it given? This COVID vaccine, the Pfizer vaccine, is injected under the muscle. Now, the next question that might come up in your mind is, who should not get this vaccine? Anyone with a severe allergic reaction, also called anaphylaxis to vaccine ingredients, should not get this vaccine. And any one of you who had this vaccine before and had a severe reaction, you should not repeat this vaccine again. Now, many of us, including me, always worry about the side effects. So here are the most important warnings and precautions before you get this vaccine. The number one major concern with this type of vaccine is the side effect of myocarditis or pericarditis, which is a rare form of heart inflammation, mostly in younger males, typically 12 to 24 years of age. And usually this happens within a week after the injection. But the good news is, most of the people do recover quickly. Now, the other major concern and warning is fainting or syncope. This can happen with any injections, and usually the injections are given in a clinical setting where the provider are well aware of the side effects and how to handle this. Now, the third important warning and precaution is anybody who has immune suppressing conditions or those who are taking immunocompromising medications. These medications may make your immune system weaker and the response to vaccine might be weaker, but it is still considered to be beneficial. For my RA patients on methotrexate or biologics, vaccine may not be as strong, but some protection is far better than none. Hence, we still recommend getting those vaccines. But it's very important to consult with your rheumatologist to understand the best timing when you should get your vaccine. Now, let me go a little more deeper on some of the other common but less serious side effects. Now, in adults and teenagers, the pain at the injection site reaction is not uncommon. Almost 90% of you could get pain in those areas. Fatigue is also very common in almost more than 77% of the people. Headache, muscle pain, and chills are also not uncommon. And some of you might also get some fevers. Now, joint pain is also not uncommon, found in almost 27% of the people with this vaccine. Now, in particular, for those who have rheumatoid arthritis, you might feel more pain in your joints. But the good news is most of the joint pain is mild and it rarely leads to arthritis flares. Now, let me share with my personal experience. When I got my own booster, I had a sore arm and felt tired for a day or two. Most of my patients say the same thing, and many say that they would rather deal with one day of soreness than the weeks of severe COVID-19 infection. Hence, it might be worth the pain. Now, the other important question that we also need to understand and remember is, what does this vaccine does not do? Now, it may not protect everyone. Breakthrough infection can happen, but the vaccine greatly reduces your risk of having severe illness requiring hospitalization and even death. Hence, it may not protect everybody, but those who get the vaccine are less likely to have those complications, including severe illness, hospitalization, and even death. That's why I tell my patients, the vaccine is like a seatbelt. It does not prevent every accident, but it makes the outcome far safer. Hence, the COVID-19 vaccine does decrease your risk of death. Hence, it's important for these group of people to get this vaccine. Now, have you or any of your loved one had any side effects from the COVID-19 vaccine? Were they mild, moderate, or something more concerning? Please share your experience in our comments. I would love to hear and respond to those comments. Now, let me summarize what we discussed today. Today, we covered the official COVID-19 Pfizer vaccine details. We discussed about who is it for, how is it given, warning, and some of the common side effects. And remember, while no vaccine is perfect, this one is one key tool in reducing your risk of severe COVID-19 infection, in particular, those people who have underlying medical conditions. As always, I encourage you to think about your health in a whole person way, through nutrition, exercise, sleep management, and stress management, and through faith, family, friends, and fulfillment. The vaccine is one of the layers of protection, but your lifestyle and support network matter just as much. Now, let me quickly recap those 3 important steps that you can take today to control your health. Number 1, talk to your doctor, especially if you have chronic illness. Discuss the timing and safety of the vaccine before getting those vaccines. Number 2, support your body with the NESS, N-E-S-S, nutrition, exercise, sleep, and stress management. Eat an anti-inflammatory meal, hydrate, and rest well before and after your vaccines. And number 3, stay connected. Share your vaccine experience with family and friends, building trust and reassurance in your circle. If this video gave you the clarity, please like, subscribe, and share with others who may feel overwhelmed about the COVID-19 vaccine. And remember, all the RAers and friends, you are not alone. Together, we can move from fear to empowerment, from uncertainty to confidence. And this is Dr. Subedi, your rheumatoid arthritis coach at the Room Doc, reminding you your health journey is powerful and every choices you make brings you closer to living fully and well despite the diagnosis of autoimmune condition like rheumatoid arthritis. Bye-bye.